We are about to bust some health myths since March is Colorectal Cancer Awareness Month. And here to help me do that, I have colon and rectal surgeon Dr. Val Simiano and gastrointestinal nurse practitioner Jennifer Fijor, both from Virginia Mason Franciscan Health. Thanks for being here.
Thanks for having us.
Thanks for having us.
It's okay. This is important because I also thought a lot of these things were myths until I had an experience when I went, oh, I got to go get this checked out. So let's start with myth number one, Jennifer. It is about screening without symptoms. So people say, maybe they think, I don't have any symptoms. Why do I need to go get screened? How cautious do people need to be?
This comes up a lot. The issue is colorectal cancer is typically asymptomatic as it's developing, especially even polyps. So oftentimes you won't experience symptoms until it's kind of further on down the line. And so the key with this is early detection. We want to catch it before it becomes an issue. So most people will not present with symptoms, and that's why we recommend screening at age 45 or older, or even sooner if you have a family history.
Okay. So Dr. Simiano, myth two is about outcomes. Many people might even be scared to get screened because they have something going on and they're afraid because they think colorectal cancer is fatal. Is that the case?
Yeah, I think I want to answer that two ways. The first is I think it is important to know that colon cancer is the #2 cause of cancer death in the U.S.
Okay.
And by 2030, it's going to be the #1 cause of cancer death in men and women under 50.
Okay.
So it's important. This year, there's going to be 53,000 people who die of colon cancer in the U.S.
Kidding.
The flip side of that is probably 2/3 of those cancers would have been preventable if detected and treated early.
Okay, so you just blew the lid off of this thing. You know, we hear, I mean, obviously all the other cancers are very pervasive and are very deadly, but I don't think any of us, I can say myself and y'all out there included, did not realize the threat that colon cancer poses to all of us. So Jennifer, I got another myth for you. It's about prevention. Myth number 3 is about prevention. There's nothing I can do to prevent colon cancer. Is that true?
So there are kind of a series of what we call risk factors. There's non-modifiable risk factors. Those would be things like underlying illnesses, family history, but knowing those things and understanding that you could be at an increased risk puts you in a better place for getting screened early or more frequently if necessary. And then you have non-modifiable risk factors. Modifiable risk factors. Those are things that you can prevent. So those would be your diet, lifestyle, and there is some evidence to show that there are things that can increase your risk of colorectal cancer, such as heavy alcohol intake, tobacco use, eating excessive red meats, especially charred red meats, lack of fiber, like good fruits, vegetables, whole grains, lack of exercise. So trying to really be on top of those things can actually help reduce your risk of colorectal cancer.
Okay, we need some apples over here, y'all. Let's fiber up. I have another myth for you, Jennifer. Myth number 4, it's about age. And I think that Dr. Simiano also kind of already answered this, but the myth is that only older people get colon cancer. Yeah. What about younger people?
The data is actually coming out that there's been an increased risk of early onset colorectal cancer since the 90s. We've done a really good job at reducing the amount of patients who are over 50, but we've actually done a worse job at trying to predict the early onset colorectal cancer. So there is a rise in that, and we're not quite sure exactly why, but because of that, it's really important that young people who are not of age to get screened really know the red flag symptoms.
Yeah.
So the red flag symptoms would be things like rectal bleeding, unintentional weight loss, anemia of unknown causes. There's also change in the bowel habits greater than 2 weeks, not just a little stint, but greater than 2 weeks. And then any kind of GI symptoms associated with those other issues I mentioned is a good idea to discuss with your doctor or provider.
Can I ask a question that might be gross to y'all out on television, but I want to ask it? I've heard that the color of blood, that if you do have blood come out, that it's dark blood that we really have to worry about versus red blood. Is that true, or is that another myth?
Not necessarily, no.
Oh, okay.
So there are things that are more close to the end of the colon. So rectal, for example, would be a brighter red color, just because of how far down to the end it is. Something higher up might be a darker red or a black color.
Okay.
So knowing black tarry stools, maroon stools, even bright red blood is still something to get concerned about.
Okay. All right. Good to know. It's what got me into the doctor. Tell you what, not to overshare, but you know what I feel like. All right. So myth number 5, Dr. Simiano, is about polyps. Now, having polyps, a lot of people think, oh my gosh, I have cancer from a polyp. Is that true?
Kind of. Not all polyps necessarily are going to be the kind of polyps that become a cancer. But it's also hard to tell until you take out the polyp.
Yeah.
So I think one important message is that if the cancer is detected early in a polyp, sometimes that polyp is taken out and cancer is prevented altogether.
Okay.
The other is that these polyps don't grow so quickly. We think that most polyps become a cancer over 5 to 8 years, so we actually have time to get ahead of them.
That's good.
And prevent cancer with colonoscopy.
My last myth before we run out of time that I want y'all to bust for me is, it's about family history. If I don't have a family history of this, I'm in the clear, right?
Yeah, I think Jennifer just outlined a lot of other risks. We think as many as 1 in 4 cancers have some sort of pattern that is passed down in families. But we also know that the other 3/4 do not. So I think the biggest thing you can do is ask your provider on what your individual risk factors are. We have risk calculators. You can put in your own individual risk into that, and they can guide you on what the best test and how to best prevent it would be.
Got it. Okay. Asking for a friend. If somebody had their last colonoscopy at 40 and it's been about 5 years, I mean, when is a good time they should maybe go back? I just want to tell my friend.
I can answer that. Again, it does matter on your risk factors. So some people that had a totally clean colonoscopy without risk factors can go as many as 10 years between. But any other risk factors, polyps, family history, some of the other risk factors Jennifer talked about, you probably need it sooner.
Copy that. Thank you, doctor. Thank you so much to both of you for being here and talking about this. It's so important. And if you want to learn more about what we discussed today, please visit the website on your screen, vmfh.org/screening. Don't wait.
This portion of New Day Northwest is sponsored by Virginia Mason Franciscan Health.